those who are no-shows for appointments. Each office should have a policy to deal with this situation. Be sure to familiarize yourself with the policy of the office in which you work. When a patient is a no-show, this should be documented in the patient record. You should attempt to contact the patient by phone to reschedule the appointment. On the appointment book, indicate that the patient wished a no-show and if a new patient was scheduled. If the patient continually missed a scheduled appointment, the physician may choose to dismiss the patient. In this case, a certified letter needs to be sent to the patient and a copy kept for the medical record. This is important to follow through on because if a patient becomes seriously ill or injured as a result of missed appointment, the physician may need the documentation to protect him or herself if an liability case should arise. Some practices will charge a fee for a no-show appointment.
The next stop is City Hall Mill Valley College Station.
Cancellation.
This is Southland.
There will be instances when the patient will need to cancel an appointment. The medical office assistant should draw a line through the patient's name in the scheduling book and make notation. When the patient reschedules the appointment, the medical office assistant can then erase the cancelled appointment after the rescheduled appointment is noted in the book. If the patient fails to reschedule a cancelled appointment, it may be the medical office assistant duty to call the patient. Any cancelled appointments need to be noted on the patient's medical record. It is very important to keep this documentation up to date as a patient's medical condition can deteriorate as a result of cancelled appointments that are not scheduled in a timely manner. It is possible that the patient requires regular medical attention. Documenting cancelled appointments and attempts to reschedule with the patient protect the physician from litigation that could arise. Sales representative. Many medical offices and clinics receive visits from pharmaceutical representatives and or medical equipment sales representatives. It would be better serve the physician, office staff, and the patients if the medical office assistant would block off specific time for such visits. One desirable time is around the lunchtime hour. Patient appointment outside the office setting. Patients may require a laboratory test, x-ray, surgical procedure, or other diagnostic test outside the office setting. The medical office assistant will be involved in scheduling these tests and the procedure. Before starting the scheduling, the medical office assistant will need to take into consideration the patient's insurance if pre-authorization is required, as with HMO, the patient's age. If multiple tests are needed, they may need to be scheduled on different days for elderly or very young or exempt patients, and the urgency of the test or procedure. It is helpful if you can schedule around the patient's work schedule if possible. Depending on the situation, this may not be possible. Laboratory test and x-ray. Many laboratories and x-ray facility use the open hour system of scheduling. That is, within specified hours of operation, the patient can arrive at any time and will be seen on a first-come, first-served basis. You will not need to book an appointment for these procedures. Check the physician's orders to see if it specifies when the test should be done and instruct the patient accordingly. Also, you should make the patient aware of any special preparation involved. For example, if the patient is being sent for blood work to measure cholesterol level, he or she should know that they should fast for about 12 hours. Going in the early morning for the blood work is most practical since most of the fasting is during sleep time. Also, make sure that the patient knows where the laboratory is located. Diagnostic procedure. More involved diagnostic procedure will require that an appointment be made. These particular tests are performed by specially trained technicians. Some of them are long and involved. Therefore, they should be booked in advance. When booking a test for a patient, verify the type of test by reading the physician's order. The physician will usually indicate if the test should be done stat. If not an emergency, book the patient for a time and a date that is convenient for them. Contact the patient's insurance carrier to see if a pre-authorization is required. Contact the facility in which the appointment will be performed and arrange a convenient time for the patient. When you book the appointment, you will give the other office the patient's name, age, address, telephone number, as well as insurance information. Check to see if there are any special instructions to give the patient. For example, for an obstetrical ultrasound, the patient is instructed not to void and must drink a specified amount of water prior to the test. To ensure better patient care, most offices have a surgical flow sheet that is often color coded to assist the physician and patient when a surgical procedure is indicated. There are usually 3 sections to the flow sheet. The top section is completed by the physician and includes specific instructions, such as the type of procedure and any preparation needed. The second section is complete by the patient and includes such items as insurance information and emergency contact information. The final section is complete by the medical office assistant and includes such specific information as to date, time, and the place of procedure. The medical office assistant should review this information with the patient to ensure patient understanding. If there are any specific instructions regarding patient preparation for the procedure, it should also be complete and explained to the patient. Whenever possible, include written instruction, as this will avoid confusing after the patient leaves the office. There are numerous tests and procedure that cannot be complete if the patient is not properly prepared. This can waste valuable time of both the physician and of the patient. Ref to Figure 1 for an example of a surgical flow sheet. Hospital surgery scheduling form.